Hello, my name is Brittany Barlow. The reason for this slideshow is to present information on contraceptives and birth control methods. The slideshow gives a general idea of the different options that people have. By having different options of birth control available, people may be more inclined to use them. Men and women can choose the method of birth control that is most suitable for them in terms of cost and effectiveness. The condom is the most common form of birth control on the market today. Condoms are 99.9% effective at preventing pregnancy. The condom should be worn by a male every time sexual activity is involved. A condom is the only form of birth control that also protects against STDs. Condoms are one of the most effective forms of birth control and cost only about $1 or are sometimes free. The second most common form of birth control is the birth control pill. The birth control pill is taken by mouth every single day. Unfortunately, these pills do not protect against STDs. There are many different brands of birth control pills on the market today that cost anywhere between $15 and $50 a month. Different pills may work differently for different people. By talking to your doctor or healthcare provider, they can help you choose which one is suitable for you. Since the pill does not work for everybody, another form of birth control is the birth control ring. The most common birth control ring is the NuvaRing. This ring prevents pregnancy. The cost is about $15 to $18 a month. Another common form of birth control is the birth control shot. This injection is of hormones that prevent pregnancy. The birth control shot is administered every 3 months or 12 weeks. This shot is commonly known as Depo-Provera. Depo-Provera does not prevent STDs. The injection costs about $35 to $75 per injection, and it has a very high effectiveness rate. Another hassle-free form of birth control is the birth control patch. This patch is placed on the body. For effectiveness, the patch is changed once a week for 3 weeks. Then there is a patch-free week in between. The patch does not protect against STDs. The most common form of the birth control patch is Ortho-Evra. The patch costs between $15 to $80 a month. A not so common form of birth control is the diaphragm. This form of birth control covers the cervix to prevent pregnancy. A spermicide, jelly, or cream is added to the diaphragm to prevent pregnancy. The diaphragm may be inserted and removed by yourself. Unfortunately, the diaphragm does not protect against STDs. The cost of the diaphragm is between $15 to $75, and it's not a very effective way at preventing pregnancy. A cream or jelly that is used with the diaphragm is a spermicide. This jelly or cream costs about $8 per pack and can be purchased at any drugstore. Lastly, another common form of birth control is the IUD. IUD stands for intrauterine device. There are 2 versions of this device currently. The IUD can prevent pregnancy but cannot prevent STDs. These devices last anywhere from 5 to 12 years depending on the form you choose. This is a very effective method of birth control. The cost of the intrauterine device is between $500 and $1,200 up front, since it's a long-term method of birth control.